Hi, my name is Dr. Douglas Scarata at the Modern Nose Clinic. I'm the medical director. I've had the opportunity to meet many of you, but some of you I haven't yet met, and I hope I do at some point in the future. And as we all know, this has been just a terrible time, tragic that we're dealing with COVID-19. It's been a hard decision for the Modern Nose Clinic because our goal is to keep our staff, our team as safe as possible, to do whatever we can to minimize any risk to them, while also serving our patient community. We feel a sense of responsibility to stay open as long as possible and to offer treatment for those people at greatest risk of COVID. We have discussed this at great length and decided the allergy patient population is particularly vulnerable. They're sneezing, they're rubbing their eyes, they're rubbing their face, they're spreading secretions all over the place, and it's unconscionable for us to shut down. So for those patients that you have with allergy problems, we will get them in quickly because we have our virtual appointments. And even on site in our clinic, we're able to see patients in separate rooms. And when necessary, we'll bring high-risk patients in, high risk in that they're vulnerable, and they'll be seen with all of our protective gear. So we will get those patients seen quickly. We also think our sinus population is also at risk. They can't afford to breathe through their mouths. If you're a mouth breather, you inhale the virus directly into your lungs, and these are the patients who are ending up on respirators. If you fight the infection in your lungs, you basically have a cytokine storm in your lungs, and you will end up not breathing well. We want you to fight the battle in your nose, and we want you to feel the flow, feel the airflow. So we will treat your sinus patients also. We'll get them in quickly. There are two highest priorities. It's also been shown that males that are 55 and older with hypertension for reasons are also at risk of not doing well when they get the COVID-19. Those patients are also patients who have sleep apnea. Males over 55 with hypertension are also the same demographic as people with sleep apnea. We can do home sleep tests. We do an oral appliance. We will get those patients in quickly. But if you have these patients and you have nowhere else to send them, please try sending a few patients to us and see if we can't get them in quickly and see if they're not happy. We would expect them to have a good experience. We will do our best to stay open, assuming that there is a need for these services. And thank you for taking the time to meet me virtually through this video. Signing off, Dr. Douglas Scarata with the Modern Nose Clinic. And you know I need to say it, we know your nose.